Joining me for this CEO Spotlight is John Thomas, the President and CEO of Physicians Realty Trust. John, thanks so much for joining us.
Thank you for having me.
Now, your company has and continues to be active on the acquisition front. Can you talk a little bit about what are the biggest challenges involved when integrating new acquisitions?
Yeah, so this year we did the largest transaction ever in the medical office space. We're buying buildings directly from a provider. It's a $700 million transaction where we bought assets that had historically been owned and managed by Catholic Health Initiatives, their hospitals around the country. So in integrating those buildings, again, we're not only coming in as a new landlord, but we're trying to deliver a new level of service. Hospitals have medical office buildings to house their doctors. They're not there to kind of treat the tenants as tenants in a customer service way. So integrating those buildings, kind of changing the mindset, alleviating the fears that we're going to raise rents and the physicians are going to want to move out is, things that we work hard to do. And with CHI, we got a very positive result, and the tenant's been very happy and pleased. And again, we view that as a customer service we can take to the next hospital and trying to convince them to sell us their buildings.
What trends are you seeing across your portfolio geographically?
So we're in about 30 states. I think, again, we're in the healthcare business, so the trends we see really are consistent across the country. There's not a lot of new development in medical office space as there are in other asset classes like senior housing. So we're not seeing big upticks in development. The results of the election may slow some of the new development down, and we'll talk about that in a minute. But the geographically, again, continue to be very positive. People are getting older, they're going to the doctor, and they're needing to go to medical office buildings.
And you brought up the election. That's obviously front of mind for everyone. So as you look at 2017 with the election behind us, what do you think are going to be the biggest drivers of healthcare real estate, and how's that going to impact your company?
Well, again, we think medical office is a real winner because of the demographics. We've always thought it didn't matter who's in the White House or who's running Congress. Again, 11,000 people are turning 65 every day, more people needing to access care, not less. And both government policy and commercial insurers in a bipartisan way, are trying to get care provided in the lowest cost setting to save tax dollars, but also to improve the quality of care. Again, we think all of those are very positive drivers for the medical office building industry. We think hospitals will continue to consolidate each together and try to drive down the cost of care. Paul Ryan's plan, the better way, if you will, we see as probably the outline of whatever comes out of the new White House. Fortunately, the chairman of our board is Tommy Thompson, and has got a good ear and a good voice in the new policy decision makers. So again, for medical office, we think it's an exciting time and continues to be, and we'll have to see how, whatever replacement legislation affects hospitals and be very cognizant of that. But again, we think it's very positive.
John, thank you so much for joining us.
Appreciate it.
For more from REITWorld 2016, be sure to visit REIT.com.